Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a neurologist talking to a patient called Mr. Max. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Max. How are you today?
Good afternoon. I've been struggling with migraines and it's been really tough to manage.
I'm sorry to hear that. Could you give me some more details about your migraines and any other symptoms you've been experiencing?
Of course. I've been having severe migraines for the past 2 years. They usually start with a throbbing pain on one side of my head. It is really difficult to manage. It will be accompanied by nausea and sensitivity to light and sound. The episodes can last anywhere from a few hours to a couple of days.
That sounds quite debilitating. Have you noticed any specific triggers that seem to bring on these migraines?
I have tried to follow my issues and even I used a diary to take notes, and I think stress and lack of sleep are the main culprits which sets off headache. I also find that certain foods, like chocolate and red wine, can sometimes trigger an episode.
What do you do for a living?
I'm a school teacher. The stress of managing classes and preparing lessons can be overwhelming at times, which I think contributes to the migraines.
Have you had any previous medical conditions or treatments for migraines in the past?
I had tension headaches when I was younger, but they weren't as severe as these migraines. Over the past year, I've seen my general practitioner and an ENT specialist, but the treatments they prescribed didn't provide much relief. I was referred to a clinical psychologist by my GP, and I learnt progressive muscle relaxation, which helped me with headaches as well as my exam-related anxieties. I didn't continue to practice it though, due to lack of time. I've tried over-the-counter pain relievers like ibuprofen and acetaminophen. My GP also prescribed triptans, but they didn't seem to help much. I've also been taking preventive medications, but the migraines persist.
Have you made any lifestyle changes or tried any alternative therapies to manage your migraines?
I've tried to manage stress through yoga and meditation, and I've adjusted my diet to avoid known triggers. Initially it was hard to change my routine, but I got adjusted after few tries. I've also tried acupuncture, but the results were inconsistent. When it comes to sleep, I can say I am a poor sleeper. Few days I find it hard to fall asleep. I use mental imagery which makes me fall asleep faster.
Is anyone in your family have any conditions, stroke, mental illness?
My parents are doing well. I have never heard anything like that, but my grandpa suffered stroke and he passed away 2 years after that attack. Other than that, there is nothing important to mention, I believe.
Now, I'll be assessing your medical history, conducting a physical examination, and possibly ordering some tests to rule out other conditions. Based on the findings, we might consider a combination of medications, lifestyle changes, and possibly other therapies.
What tests do you need?
Well, you may be required to take a CT scan. We'll also discuss strategies for managing stress and improving sleep quality, as these are significant triggers for you. Incorporating relaxation techniques and establishing a consistent sleep routine can help reduce the frequency and severity of your migraines.
I'm open to trying anything that might help.
Based on what we discussed so far, it seems like you might be having migraines due to stress. We'll wait for the test results to make sure there isn't anything serious going on.
End of Extract 1. Extract 2, questions 13 to 24. You hear an endocrinologist talking to a patient, Mr. Smith. You now have 30 seconds to look at the notes. Hi, Mr. Smith. How are you today?
Hi, doctor. I've been having a rough time with my diabetes lately. My blood sugar's all over the place, and I'm just feeling really tired.
I'm sorry to hear that. Can you tell me more about what's been going on?
Sure. I've had type 2 diabetes for about 8 years now. Lately, my blood sugar levels have been really high, and sometimes they drop really low out of nowhere. I also feel super thirsty all the time and have to pee a lot. I can't do anything while I am going through this. On occasion, I also feel off balance and room around me spinning. I always keep energy drink handy to help me in these situations.
That sounds quite tough. Have you noticed anything specific that seems to affect your blood sugar levels?
Yeah, I think stress and what I eat play a big role. I also don't sleep very well, which doesn't help. I try to keep an eye on what I eat. I always try to take more fiber by having vegetables, oats, and whole grains. I have noticed that with few breakfast menus, I have more issues. For instance, when I have pancakes with maple syrup.
What do you do for work?
I'm a truck driver. The long hours and irregular schedule make it hard to keep a consistent routine.
That must be challenging. Have you tried any treatments or medications for your diabetes?
I've been on metformin and insulin for a while. My GP referred me to you because we're having trouble getting my levels under control.
Have you made any changes to your lifestyle or diet to help manage your diabetes?
I've been trying to eat better and get some exercise, but it's hard with my job. I check my blood sugar every day, but it's still all over the place. I have started to go cycling daily for 30 minutes. I am trying to be consistent with this.
Do you have any family members with diabetes or related conditions?
Yeah, my mom had type 2 diabetes, and my sister was diagnosed a few years ago. It seems to run in the family. Now my mom takes insulin regularly, but I want to appreciate my sister. She's older than me, and she did reverse her diabetes. I wonder how she could do that, but I should give credit to her strength. She took it seriously. Entirely changed the way she eats, started stress reduction through yoga, and took a gym membership. I always look up to her.
Family history can definitely play a role. Let's do a thorough evaluation to get a better understanding of your condition and any potential complications. We'll then develop a treatment plan tailored to your needs. Does that sound good?
Yeah, that sounds good. I'm ready to figure this out.
Great. During the evaluation, I'll review your medical history, do a physical exam, and possibly order some tests like HbA1c to check your blood sugar levels and overall health. We might also adjust your medication.
That sounds like a good plan. I appreciate the help.
We'll also talk about ways to manage stress and improve your sleep, since those are big factors for you. Finding a balance can help stabilize your blood sugar levels.
I'm willing to try anything that might help.
Together, we'll create a comprehensive treatment plan that includes medication adjustments, lifestyle changes, and stress management techniques. With time and consistency, you should start to see improvements. Let's get started with the evaluation now. End of Part A. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a senior pharmacist briefing doctors and nurses.
Good morning, dear colleagues. I want to thank all of you for following recent changes made to guidelines on medication management. I would like to appreciate efforts of nursing staff in reducing errors while placing orders. The survey report suggests that errors in medication orders have come down drastically. I want to mention about a recent global and national developments, where recent research done at national level throws light on a significant problem of superbugs medically termed as multi-drug resistant organisms. It has been established clearly the reason behind this is non-judicious use of antibiotics at all levels of care. Hence, I would like to remind you about our hospital policy on antibiotic prescription and usage for both outpatient and inpatients. It is high time that we stand together to address this very concerning problem of drug resistance. It will save millions to the hospitals across the country if we reduce burden of drug resistance. I sincerely hope we will be able to avert the catastrophe by taking timely action.
Question 26. You hear an optometrist talking to a patient.
Mr. Mills, you are doing great after cataract surgery. I wanted to give you some instructions you should be following once you go home today. It is important to protect the operated eye from dust and sunlight. You can use dark sunglasses and stay indoors for few days.
Okay, I can do that. What about the eye drops? I am getting 3 different types now. It won't cost much though.
Yes, you need to continue to administer eye drops twice daily for the next week, and then bring down the frequency to once a day for another 1 week. We will discontinue it after 2 weeks.
But, I get picking sensation when I take the drops. I don't know whether I will be able to tolerate it, though.
It is fairly common. It is a side effect of the drops. You need not worry about it. It will be resolved on its own when you stop taking drops after 2 weeks.
Question 27. You hear a patient talking with midwife.
Hi Maureen, how are you doing today?
I am well, thank you. Baby is also doing fine. Though he had some hard time initially with suckling, I think he got used to it now and I can manage with no problem. I remember with my first child couple of years back I needed help with feeding since I was exhausted immediately after childbirth.
I understand. Are you in pain? Do you want me to get you a painkiller?
Currently I'm comfortable, don't think need any pills for now. The painkiller which I got earlier did a good job. Rather I would be glad if you can explain me about some treatment with, like for jaundice. The doctor was earlier concerned about my child's blood tests.
Well, the treatment is called phototherapy, and if your child's bilirubin level fails to come down, he may need that. It will be provided at your bedside. You should be feeding him frequently during therapy to prevent dehydration. He may need this treatment for 24 to 48 hours.
Question 28. You hear a manager briefing hospital staff.
Good afternoon, team. Today, I would like to discuss about the incinerator in our facility. As you know, the incinerator plays a crucial role in managing medical waste, ensuring our hospital remains clean, safe, and compliant with health regulations. However, it is also important to recognize the potential hazards associated with its operation. The established standard operating procedures, SOPs, for loading, igniting, and monitoring the incinerator must be followed at all times. Ensure that the waste being incinerated is suitable for the incinerator and does not include prohibited items such as pressurized containers, explosive materials, or high moisture content waste. Always wear the designated PPE, including gloves, safety goggles, face masks, and heat-resistant aprons, while operating the incinerator. Inspect your PPE before use to ensure it is in good condition and fits properly. Familiarize yourself with the emergency shutdown procedures and the location of emergency equipment such as fire extinguishers and first aid kits. In the event of an emergency, evacuate the area immediately and alert the emergency response team. Thanks for your continued support. We were able to keep the safety incidents to a minimum.
Question 29. You hear a hospital director speaking to hospital staff.
Today, I want to address a matter of utmost importance that affects every one of us and, more importantly, the patients we are here to serve. Recently, we have observed an increase in patient safety incidents within our hospital. This is a serious concern that requires our immediate attention and collective effort to address. First and foremost, I want to reiterate our unwavering commitment to patient safety. Each one of us plays a crucial role in ensuring that our patients receive the highest standard of care in a safe and secure environment. It is our duty to uphold the trust that patients and their families place in us. To address the recent incidents, we will be conducting a thorough review to identify the root causes. This involves analyzing incident reports, gathering feedback from staff, and examining our current protocols and procedures. I urge everyone to actively participate in this process by providing honest and constructive input. We recognize that ongoing training and education are essential to maintaining patient safety. Therefore, we will be organizing additional training sessions and workshops to reinforce best practices and ensure that all staff members are equipped with the knowledge and skills needed to prevent incidents.
Question 30. You hear a nurse briefing her colleague.
We have a patient named Joseph, admitted to the ward through emergency department. He was suffering from retrosternal pain and dizziness. He received sublingual nitroglycerin en route to hospital via ambulance. Currently, he is on supplemental oxygen 2 liters per minute. And got his 4-metoprolol as per doctor's order. His blood pressure, heart rate, respiratory rate, and oxygen saturation must be recorded every 15 minutes for the first 24 hours. He needs to be enrolled in a cardiac rehabilitation program to improve cardiovascular health and prevent future cardiac events, which will be taken care by social worker in next couple of days before his discharge. Counselor will educate the patient on heart-healthy lifestyle changes, including diet, exercise, smoking cessation, and stress management, maybe tomorrow. There is also need to schedule regular follow-up visits with the cardiologist to monitor the patient's heart function and overall health.
End of Part B. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah regarding gene therapies. You now have 90 seconds to read questions 31 to 36.
Good afternoon, everyone. Today, I am joined by Dr. Sarah, renowned geneticist and researcher, who practices in cutting-edge medical facilities. Dr. Sarah, what would you like to say about the current state of gene therapies?
Good afternoon. Thank you for having me. Gene therapies represent a revolutionary advancement in medicine, offering the potential to treat and even cure genetic disorders at their source. More than 200 phase 2 and 3 gene therapy trials are currently underway, which could translate into up to 40 new products being approved for clinical use in the next decade, and the potential eligibility of 1.09 million patients for this therapeutic modality in the next 15 years. The availability of more gene therapy products will bring profound changes to the treatment landscape of many rare genetic diseases, which will offer for the first time potentially curative options for patients. However, accessibility to these therapies remains a significant challenge. We must address multiple barriers, including high costs, logistical issues, and regulatory hurdles, to make these life-saving treatments available to all who need them.
What are some of the major barriers to accessing gene therapies?
There are several complex aspects to consider. First, the cost of gene therapies is prohibitively high. Developing these treatments requires significant investment in research and development, clinical trials, and regulatory approvals. As a result, the final cost to patients and healthcare systems can be immense. Imagine a cutting-edge car manufacturing company has just developed a revolutionary electric vehicle. Initially, the company needs to invest a huge amount of money in research and development. Next comes the process of regulatory approval. When the car is finally ready for market, it's priced higher than conventional vehicles. The high price reflects the significant investment in R&D, the low initial production volume, and the need to recoup those costs. Additionally, there are logistical challenges, such as the need for specialized facilities and trained personnel to administer these therapies safely and effectively. Furthermore, healthcare providers must navigate complex regulatory frameworks to ensure that gene therapies meet stringent safety and efficacy standards.
How do these costs impact patients and healthcare systems?
The high costs create a substantial financial burden for patients and their families, often limiting access to those who can afford it or have comprehensive insurance coverage. In many instances, health insurance providers would not cover the costs of new treatments. For healthcare systems, funding these expensive treatments can strain budgets and lead to difficult decisions about resource allocation. In some cases, patients may have to travel long distances to access specialized treatment centers, adding further barriers. Moreover, the high costs can result in inequities in access, with marginalized populations facing greater challenges in obtaining these therapies. The worry is that the commercialization of gene therapies might further penalize disadvantaged communities and ethnic groups that, on average, have lower incomes and more restricted access to healthcare.
Are there any specific genetic disorders that have seen significant advancements in gene therapies?
The first gene therapy product to be approved for a congenital disorder in the United States was Vortigern Neparvovec, for the treatment of vision loss due to inherited retinal dystrophy. This was launched in the market in 2017 at a cost of $425,000 per eye for a single dose. More recently, onasemnogene abeparvovec, for the treatment of pediatric patients with spinal muscular dystrophy, became the most expensive drug on the market, costing $2.1 million per dose. With the handful of gene therapies already on the market costing on average 30 times the median household income in the United States per dose. Sickle cell disease is considered an ideal candidate for gene therapy, and 9 clinical trials are currently underway. Experts believe that gene therapy products for sickle cell disease will probably cost $1 million for a one-time dose. The real challenge is not to find a cure for these rare genetic diseases, rather to find a solution to benefit deserving group of people.
What role do regulatory agencies play in improving accessibility to gene therapies?
One may wonder these agencies have no role in improving accessibility. Well, that is not the case. Regulatory agencies are crucial in ensuring the safety and efficacy of gene therapies. However, the approval process can be lengthy and complex, delaying the availability of new treatments. Streamlining regulatory pathways and providing incentives for innovation can help expedite the approval process and make these therapies more accessible. Additionally, collaboration between regulatory agencies, healthcare providers, and pharmaceutical companies is essential to address affordability and distribution challenges. By working together, these stakeholders can develop strategies to balance safety and accessibility, ensuring that patients receive timely and effective care.
How can we address the disparity in access to gene therapies on a global scale?
Addressing global disparities requires a multifaceted approach. Increasing investment in genetic research and infrastructure in low- and middle-income countries is essential. International partnerships and funding mechanisms can support the development and distribution of gene therapies in underserved regions. Furthermore, educating healthcare professionals and the public about the benefits and availability of gene therapies can help build demand and drive policy changes to improve access. Efforts to reduce costs through innovative financing models and pricing strategies can also play a crucial role in making these therapies more affordable and accessible worldwide. Although it is unlikely that a unified, global solution will overcome all of the accessibility challenges, moving forward, drug companies, payers, policymakers and patient advocacy groups need to work together to develop innovative solutions to ensure that access to gene therapies is truly equitable.
What is the future outlook for gene therapies and their accessibility?
Despite the overwhelming obstacles, the future of gene therapies is promising, with ongoing advancements in technology and research. As the field progresses, we can expect to see more effective and affordable treatments becoming available. Efforts to reduce costs, streamline regulatory processes, and increase global collaboration will be critical in making gene therapies accessible to all who need them. Ultimately, the goal is to ensure that these life-changing treatments reach patients regardless of their socioeconomic status or geographic location. Continued investment in research and development, along with policies that promote equitable access, will be key to achieving this vision. And it will be done, no doubt about it.
Thank you, Dr. Sarah, for sharing your insights on this important topic.
End of Extract 1. Extract 2, questions 37 to 42. You hear a presentation by optometrist Mr. Jackson on cataract and people living with it. You now have 90 seconds to read questions 37 to 42.
Hi, my name is Robert, an optometrist working at University Hospital. Allow me to guide you through an insightful journey, exploring the lives of three remarkable individuals, each grappling with the challenges posed by cataracts. We'll delve into their unique experiences, shedding light on the trials they face, and the hope brought by modern treatments. Meet Mrs. Smith, a 72-year-old retired teacher. For decades, she dedicated her life to nurturing young minds, but recently, her world began to dim. Words on the pages of her cherished books blurred, and the vibrant colors of her garden faded into a foggy haze. Night driving became a daunting task, with headlights glaring painfully into her eyes. Her optometrist diagnosed her with nuclear cataracts, a common affliction among the elderly. The thought of surgery was intimidating, but the promise of restored vision gave her hope. Mrs. Smith underwent cataract surgery, where her clouded lens was replaced with a clear, artificial one. The transformation was astounding. Colors were vivid again, and she could read without strain. The surgery didn't just restore her vision, it reignited her passion for life and learning. Next, we meet Mr. Patel, a 55-year-old software engineer. His profession required precision and long hours in front of a computer screen. One day, after a minor eye injury, he noticed his vision had doubled, and bright lights left halos in his sight. However, he continued to ignore these signs. The discomfort grew, affecting his productivity and quality of life. A visit to his optometrist revealed posterior subcapsular cataracts in his right eye, a type that often affects younger individuals. The prospect of surgery was daunting, but necessary. Post-surgery, Mr. Patel's vision was restored, allowing him to work with renewed clarity and comfort. This experience emphasized the importance of regular eye checkups and the critical role of timely medical intervention in preserving one's livelihood. Now, let us journey into the life of Ms. Garcia, a 40-year-old professional photographer. Her keen eye for detail was her livelihood, capturing the beauty of the world through her lens. However, she began to notice something was amiss. Her vision grew blurry, and frequent changes in prescription glasses offered no relief. The diagnosis was unexpected: cortical cataracts in both eyes, a rare condition for someone her age. Determined to continue her passion, Ms. Garcia opted for cataract surgery. The results were nothing short of miraculous. Her sharp focus returned, allowing her to capture stunning images once more. The surgery not only saved her career but reignited her creative spirit, proving that timely medical intervention can turn potential setbacks into opportunities for growth. These stories reveal that cataracts are not limited by age or occupation. They can affect anyone, disrupting daily life and diminishing the quality of vision. The symptoms, blurred vision, glare, double vision, and frequent prescription changes, are common but often ignored until they significantly impact daily activities. Diagnosis through visual acuity tests, slit lamp examinations, and retinal assessments is crucial for early detection. Non-surgical management options, such as prescription glasses and anti-glare sunglasses, provide temporary relief. However, surgical intervention remains the definitive treatment, offering a permanent solution to restore clarity and quality of life. Patient education plays a vital role in managing cataracts. Awareness about risk factors such as age, genetics, medical conditions, lifestyle factors, and long-term use of certain medications can prompt early detection and intervention. Educating patients about the importance of regular eye exams and recognizing symptoms empowers them to seek timely medical attention. As optometrists, our duty extends beyond diagnosis and treatment. We must guide our patients through their journey, providing them with the knowledge and support needed to make informed decisions about their eye health. The narratives of Mrs. Smith, Mr. Patel, and Ms. Garcia illustrate the profound impact cataracts can have on individuals' lives. Their stories highlight the importance of early detection, the advancements in treatment, and the transformative power of cataract surgery. As optometrists, we have the privilege and responsibility to help our patients navigate through the haze, restoring not just their vision but their hope and quality of life. By fostering awareness and education, we can ensure that more individuals receive the care they need, allowing them to see the world with clarity and vibrancy once again.
That is the end of listening test. You now have 2 minutes to check your answers.